Good afternoon, everyone. Tragically, today, another 4 COVID-related deaths have been announced in Northern Ireland, and my heart goes out to the grieving family and friends, and I extend my deepest condolences. The past year has been an incredibly dark and difficult time for so many. An unbearable toll has been taken on individuals, on families, and on communities, on lives and on livelihoods, and on mental as well as physical health. But we are on a clear path to better times. Key indicators, including the COVID data and the ongoing rollout of the vaccination programme, are positive. Our approach, which is firmly based on the principle of cautious optimism, is producing dividends. Our latest vaccination figures show 582,881 vaccines have been administered, of which 545,000 were first doses. That's a huge achievement for Northern Ireland, and one we should be proud of. We expect the programme to be even busier in the coming weeks, with supplies of Oxford AstraZeneca vaccine scheduled to increase very significantly. The vaccination programme will be scaled up accordingly, and plans to that effect are being finalised this week. I have already announced plans to open a mass vaccination centre at the SSE Arena in the near future. In addition, I believe community pharmacists could make a large contribution to our vaccination efforts in the coming weeks, and that will be working in conjunction with our GPs and the trust-run vaccination centres to ensure the vaccine is even more accessible to people right across Northern Ireland. And the expansion of the Oxford AstraZeneca vaccine supply means we can also use it in some of our regional vaccination centres, as well as from our GPs and pharmacies. This is fast-moving and hugely important, the programme, and that is so important to all our futures. We should all be extremely grateful to all those involved in delivering this rollout. If you are eligible, book your appointment at one of the centres. Please do so without delay. And this now includes everyone aged 60 and over, the main care of an elderly or disabled person, as well as anyone who received a shielding letter because they are clinically extremely vulnerable to the virus. Alongside the vaccination, we are also expanding regular testing for COVID-19 on a targeted basis in private, public and local government sectors. This will help us detect hidden positive cases and help break chains of transmission. My department is currently actively working with partners in government and industry to identify organisations and groups to participate in this extended testing programme. I am delighted that TransLink are already participating in this testing initiative, and I intend to announce further details next week on the testing expansion. Vaccination, testing, contact tracing and more effective treatments, all these will help tip the scales in our favour in the battle against COVID-19. And of course, each one of us must continue to play our individual parts. Following all the public health advice and restrictions, that's what will help prevent the virus spreading. As I've said before, I totally understand the frustration that we cannot move faster out of lockdown or be more definite about the pathway out of lockdown. As I've stressed before, I would rather maintain a steady pace than charge for the exit door and then fall over. There's too much at risk, both in terms of people's health, but also how much more uncertainty our businesses could ever be expected to face. The time for definite dates will come, of course it will, but some of those demanding a calendar-led approach now would be the first to complain if we gave them dates and then had to alter them because of the progression of the pandemic. This virus, as we know, is not predictable. It does not follow a pre-planned route map. Likewise, I would love to be able to announce a simple mathematical formula on how the data will determine all our decisions. There are too many complexities and uncertainties, and I will not offer people false assurance. This has been an incredibly difficult 12 months, unprecedented in living memory, because in the space of a year, so many people listening have experienced bereavement, experienced fear, experienced financial concerns, but also experienced optimism and experienced a deep sense of pride and sense of unity through our community solidarity. That roller coaster of emotions has for some undoubtedly triggered mental health conditions or exacerbated existing ones. My department continues to monitor closely the impacts of COVID on a range of mental health indicators. And worryingly, we are seeing increasing mental health presentations and an increased level of acuity in mental health services. So it is important that we have the services in place to meet that demand, and it's something that was covered when the Executive's Working Group on Mental Health, Resilience and Suicide Prevention met this morning again for its fourth meeting. But that is a message I really want to make today. If you need support, or if you know of someone who does, please come forward. And there's no one better to help reiterate, I believe, that message today than Northern Ireland's interim mental health champion, Professor Swann O'Neill. So I'll hand over to Swann.
Thank you very much, Minister Swann, and thank you for inviting me here today, and also to Dr McBride for their updates. I really welcome this opportunity to speak to you all. We have had a very difficult year, and I want to start by thanking everyone for their hard work and discipline in adhering to the restrictions. It has not been easy, but you have saved lives, and that is an achievement to be proud of. The new plan published by the Executive yesterday, detailing the pathways to recovery, gives us so much to be hopeful for. I want to particularly thank our children and young people. This has been so tough for you, and we are working hard to make sure that you can see your friends as soon as possible safely. Our children have suffered, and they are going through important periods of development, and their mental health needs to be our priority. I was delighted to welcome last week the new Text a Nurse service and the launch of the Emotional Health and Wellbeing and Education Framework, jointly delivered by Minister Swann and Minister Weir at the Department of Education. This is a positive leap in supporting the mental health and wellbeing of our children and young people, and it comes with an annual investment of $6.5 million to provide this within the education sector. I know that the past year has been for many immeasurably stressful. The economic consequences and financial stress, the isolation and loneliness, and the need to juggle multiple roles and look after children, and of course the fear and worry about the virus. It's all taken a heavy toll. It's important to remember, though, that stress and anxiety are very normal responses to an abnormal situation and will usually not cause mental illness. However, it's very important that if you do have the symptoms of depression or feel that life is not worth living, you should ask for help from your GP or call Lifeline on 0808 808 8000. Unfortunately, this pandemic will lead to an increase in the numbers of people who require mental health services, and I am working with the Executive and the Department of Health to make sure that we can better meet your needs and make our mental health services better. The draft mental health strategy is our vision for what mental health services in Northern Ireland should look like. We deserve an excellent mental health service, and we need your views on this draft so that we can get it right. The consultation can be found on the Department of Health's website, and I would encourage everyone to respond to it. We know that change is needed now, and many changes are already happening. For example, the Department of Health are developing the specialist perinatal mental health service to ensure that women and their babies get excellent health care. Today, at the Executive Working Group on Mental Wellbeing, Resilience and Suicide Prevention, we discussed a number of other initiatives to support wellbeing and improvements to mental health services. The home stretch is often the hardest, So it is now more important than ever to continue focusing on your well-being and protecting your mental health. We recommend the Take 5 steps to well-being because the science says that they really work. You may have seen some of the steps on our new TV advert. The first one is to stay connected with your loved ones and reach out to people who may be lonely. This is so important because people often withdraw from others when they are struggling. If you know someone who might be distressed, it can be hard to know what to say, but it is important to stay in touch and have those difficult conversations and encourage them to seek help. The second step is to be active every day in whatever form that works for you. Going for a walk or a wheel can really help improve your mood and get rid of those feelings of stress and anxiety. Please visit covidwellbeingni.info for more information about these steps and the other 3 too, and also for resources and tips to help improve your mood during this time. Now is a good time to think about what we will do when restrictions start to ease, when we reach the stages outlined in the recovery plan. Be realistic, but make some plans for some things that you can look forward to, such as meeting with your friends or visiting family. And in the meantime, please take good care and remember, we will get through this together.
Thanks, Siobhan. Now I hand over to our Chief Medical Officer, Dr. Michael McBride, for an update on where we are.
Thank you, Minister, and thank you, Siobhan, as well. Unfortunately, as the Minister has said today, we're sadly reporting 4 more deaths of people from COVID-19, and I want to again extend my sincere and deepest condolences to the family and friends of those who have lost loved ones at this time. It is a sad fact that we have stood at these podiums far too often in the last year and sent our condolences to those who have lost family and friends. And I want to add my personal professional thanks to all of those, both in the past and recently, who have reminded us of the people behind those numbers and of the real harm and the real sense of loss as a consequence. The 2,063 people's lives that have been cut short, the impact that this has had on the many more experiencing the after effects of this debilitating virus, the impact on their lives, on their health and well-being, and for many, many more on their livelihoods, as Siobhan has reminded us. The rollout of the vaccination programme in Northern Ireland is therefore hugely important in fighting against the impacts of COVID-19. And that vaccine programme is undoubtedly saving lives and reducing the level of serious illness and hospitalisation. A recent study carried out here in the United Kingdom demonstrated a single dose of either vaccine can prevent 80% of hospitalisations in our older population. The public health advice, your response, coupled with the vaccination programme, are no doubt contributing to the reducing infection rates and hospitalisation rates that we are now seeing. I'm now going to take you through a few slides to update you on the course of the epidemic here in Northern Ireland before making some concluding comments. This first slide shows the 7-day rolling average of new cases per day. And as we can see, that daily average has declined further over the last week. That has been a consequence of the restrictions that have been in place and the decisions taken by the Executive back in December, and also as a consequence of your efforts. And as Siobhan has said, as a consequence of those efforts, you are saving lives. The 7-day rolling average of new positive tests now stands at 222, down from last week where it was at 293. And we are seeing ongoing reductions in those over the age of 60 and that is a combination, again, of the measures and the action that you are all taking, but also increasingly of the vaccination programme. The next slide shows the 7-day total cases per 100,000 of the population by local government districts. And as we can see here, in the last week, we have seen a further fall in all local government districts during the last week. And indeed, in those that were previously amongst the highest, we have also seen a fall. And we can see here Mid-Ulster is now closer to the other local government districts. Similarly, right across the common travel area, we have seen rapidly changes in case numbers, a declining picture, and the differences between the different parts of these islands is also narrowing with less marked variation. We can see here that Northern Ireland currently has a lower total 7-day cumulative total number of cases per 100,000 as compared to England and the Republic of Ireland, and still higher than Wales and Scotland. Looking at this in a different way, this is the Office of National Statistics. This is a COVID-19 infection survey. So this is estimated, modelled prevalence of the virus. And again, we can see here that Northern Ireland has a lower estimated prevalence than England. Roughly about 1 in 195 people here in Northern Ireland are estimated to have COVID-19 compared to 1 in 145 in England, 1 in 125 1 in 225 in Wales, and 1 in 205 in Scotland. This slide shows the 7-day total first COVID positive admissions, and we can see after the slight levelling off that we experienced both in case numbers and new positive admissions, last week that number has continued to fall, which is welcome news. Similarly, the total number of inpatients has also continued to fall, and if we look at the total positive inpatients in our intensive care units, this has also continued to fall, all of which is welcome news, all of which is a consequence of the efforts that you are making, and certainly is beginning the beginning of welcome respite for our hard-pressed health and care workers. So I want to be very clear about the importance of the vaccination programme. It is the breakthrough we were all hoping for, and it's the breakthrough we were all working for in the very darkest months of this pandemic. And yes, it will permanently change the impact of the virus and increasingly lessen our dependence on some of the measures we currently have in place and all of the consequences of those measures, as the Minister and Siobhan have outlined. So when it is your turn to book or to be called forward, I urge you, don't hesitate, take the opportunity and get the vaccine. Protect yourself and protect others. It also has to be emphasised, and I know that this is a difficult message, that vaccines do not provide perfect protection. No vaccine has ever provided 100% protection. The COVID vaccines are no different. These are highly effective and safe vaccines, but no vaccine is 100% effective. And while they will make a massive difference, they do not make our entire population invincible, and they will not protect everyone from this virus. At present, the vaccines are only at this time available for the adult population, and even with the very high levels of uptake, not every adult will take up the opportunity of getting the jab. Clearly, the more that do, the more we will all be protected. We don't yet have definitive evidence, although increasing evidence, on the extent to which the vaccine will limit transmission. So we do need, and will continue to need, additional lines of defence alongside the vaccination programme. And that will include the cautious, step-by-step approach to relaxing the restrictions that were outlined yesterday. It will also include increasingly the rollout of rapid asymptomatic testing, enhancements and further work on our contact tracing service, and constant improvements in the treatment of people who do develop COVID. And that key, essential other element which has got us thus far, that on which we are critically dependent on you, that vigilance, all of us doing what we need to do to ensure that we limit the spread of the virus. So that's why we continue in this approach of cautious optimism, progressing steadily, gradually, a step at a time, towards better times. And hopefully those better times are not that far ahead. Thank you, Minister.
Right, thanks, Michael. Deborah McAleese, UTV. Sorry, Deborah, I can't hear you.
Hello, can you hear me?
I hear you now, yeah.
Hello? Yes, okay, thank you. Minister, you did acknowledge that there is a lot of frustration with this roadmap, given that there's no real clear indication of a way out. But given that the vaccination programme is going so well, and the Chief Medical Officer there just said that it's a breakthrough that we'd all been hoping for and waiting for, why can we not have a more definitive path forward?
Deborah, I think this this virus doesn't have a deliberate path that allows us to set those specific dates and timelines. I think we've been clear about that even as we come out of the first wave. What this plan does is give a sense of direction of travel, what we can expect at each stage, at each step as well. So it's about showing people where we can go and where we can go next, what steps will come in what sequence. And I think as we look to the benefits that we see through compliance with the regulations, with the uptake of the vaccine, it's about getting those steps and taking them at the right time. As I said in my opening statement as well, it's about not rushing out of this lockdown so we end up rushing into another one. So the pathway is there, is to follow a progress, is to follow the data rather than the dates. It's the approach that we took coming out of the first lockdown as well, and it's an approach that has been now adopted by other governments across these islands.
My next question actually would be for Professor O'Neill. I'm just wondering how much of an upsurge in mental health cases are you seeing at the minute, and how much are you expecting? And you also said that we deserve an excellent mental health service here. Are you confident that that is going to be achievable given the budget pressures that we have and the fact that resources were inadequate before the pandemic?
So those are both really good questions. I don't have the current data to hand. We know we've seen an increase in referrals for mental health services, and people are in more distress at the time of referral. We anticipate that overall there'll be around a 20% increase in the need for mental health services, and those figures are from NHS federations. So that's a modest enough increase. So we just have to keep monitoring this really and see what happens. But our mental health services are being prepared for this increase, and we're working to meet the needs of the people who are looking to access mental health services, who need those services. The second question, again, it's really a tricky. Sorry, I've forgotten your second question. Can you do it again? Sorry.
I think I'm unmuted. Am I?
Oh, the finance and the funding. Sorry.
Yes,
sorry.
Yeah, it was just, are you confident that it's achievable for us to have an excellent mental health service given the funding pressures and the fact that the resources were inadequate before the pandemic?
Yes. So we have our draft mental health strategy, and that's a strategy for excellent mental health services. And whenever that is finalised, and we'll be finalising that soon, we will then have an implementation plan, and we'll be setting the priorities. So it's really important right now that we have your responses, your views on that mental health strategy, that draft, and that we get your views so that we can make that perfect. And then we'll be asking for funding. And these are decisions, these are political decisions. So we need to demand that our services are funded properly from the ministers who are in place at that time. But right now there is a commitment to develop our services and to make them better and make them excellent. Thanks.
Deborah, just picking up on that point in funding, I think it's the conversation that is ongoing at the minute, especially in regards to budgets being prepared and budgets being announced. One of the challenges that we always have within health is the fact that it's a non-recurrent funding. It's a one-year programme. So all of the developments, all of the initiatives that we take forward are solely for that year, because we cannot give that long-term commitment financially. It's something that I want to do. It's something that we want to do within the Department of Health, because it was widely acknowledged and recognised through New Decade, New Approach, that we did have to invest further and deeper within our mental health services, and that's why we've commissioned that piece of work, supported by the Executive, in regards to the development of our mental health strategy and action plan. Marie-Louise, BBC.
Yes, good afternoon all. I have two questions. The first one is for both the Minister and the Chief Medical Officer. Minister, you've repeatedly said that you won't be drawn on dates or on detail, but surely 1 year into the pandemic, the public deserve clarity around the targets and the numbers that are required in order to trigger progression in the exit plan. All of our actions contribute to those numbers. So where do the figures need to be around the number of inpatients, the number of new cases, in order for things to start changing?
Marie, a very good question, because we continue to monitor a wide range of data, the information and statistical indicators to inform our decisions on whether we relax restrictions or whether we need to return to strengthen them. So it's about health trends, it's about our projections and our data analysis as well. And look, the World Health Organization has set out a number of conditions for adjusting restrictions. They include maintaining the RT number above 1, our health service capacity for COVID and non-COVID patients as well, our test, trace and protect systems, and the data and the intelligence that goes around that. Are we seeing community transmission? Are we seeing transmission in specific locations? Population immunity as well, that has been developed and includes our vaccination programme and how that's progressing as well, but also the challenges of new variants. So there are a multitude of measurables there. There is no magical formula that we can simply type into a computer and get an answer that says, yes, you move forward, no, you don't. So it is about looking at those projections and those analyses as well, and that's why we keep, when we produce the data and the explanation as the Chief Medical Officer shows us where we can show those trends. I think one of the things I've heard over the past number of days, we are at the same point in infection rates as we were last September. If people go back and look at last September, 4 weeks after where we were at the same point, we were actually introducing more restrictions because the virus had taken another direction and another step. So that's why we take what I think is this precautionary step, this cautious step, because the last thing that I want to do, I think the last thing that any of my executive colleagues want to do, is come out of this lockdown too quickly so that we end up rushing into another one. Michael, do you want to? Yes,
thank you, Minister. I think you've in a very neat way summarised the sort of key metrics. And I think the basic question is the epidemic under control, yes or no? And as the Minister's indicated, there are a range of measures that we will look at. The pathway document launched by the Executive alludes to the WHO criteria. Those are criteria which will be similarly utilised in Scotland. And there are a range of measures, some of which we are now familiar with. The R number, obviously if the R number is below 1, the epidemic is shrinking. I don't want us to get to a situation where the epidemic is growing and we're seeing increased pressures on our hospital services again. So I think that increasingly will be less relevant, although will remain an important measure in terms of health service capacity. Similarly, the number of cases that we're seeing, the percentage of those cases that are related to community transmission versus the number that are related to recognised outbreaks. Hopefully, increasingly in the future, we will see localised outbreaks as opposed to a great percentage of cases relating to just widespread community transmission. And there will be a range of other measures. Again, something that people will be familiar with by now is the percentage of tests that test positive. I didn't allude to it in my slides, but today, for the first time, it is sitting at 5%. You thinking back in previous weeks, we were talking about a test positivity rate of over 20%. We were clearly not in control of the epidemic with a test positivity rate of 20%. We are now getting the epidemic under control, and the Executive will wish to be reassured that we are keeping the epidemic under control as we take these small steps forward to make the relaxations and check what the impact of those relaxations is, and making sure that once again the epidemic isn't running away from us. Because let's remember, this virus doesn't spread itself, we spread it. It's what we do, it's our behaviours, our actions and our interactions, and combined with that, obviously the mitigations that we're going to have to put in place and continue to have in place for some time to make the spread of the virus less likely.
Well, clearly we're not going to get anywhere on dates or detail or anything like that for the public. So can I turn to Professor O'Neill? Siobhan, can I put it to you? You know the importance of when you are dealing with people's mental health, when people are looking forward, and when many are at the end of their tether, when they have been through a horrendous year, perhaps grieving, out of school, out of work, have lost their business, all of these things where you clearly have said, you know by the data, people are crying out for help. You know the importance of deadlines and dates and giving people something to hang on to. What would you say to the gentleman on either side of you on the importance of giving the public a little bit more detail and clarity on the way forward, of where the best case scenario might be? Is it Easter? Is it around that time? To give people something to hang on to.
That's a really important point, Marie-Louise. I mean, people need certainty, and we need to be able to plan over the next few weeks and months for what we want to do, and that would give us hope. And hope is what we're losing right now. So I think it's very important to have that assurance from our executive that they will give us the information as soon as they have it, and that they will provide us with concrete dates as soon as that is possible, notwithstanding the need to follow the science and the data. The worst thing that could happen would be that we were disappointed again, that we're given false hope, because we've been through that too many times. So it's absolutely vital that we do this in the right way, in the right order, and we need to prioritise children and young people, let there be no doubt about that. And I'm convinced that that's what's happening. And then we get everything else opened cautiously and carefully, but as soon as possible. But please do keep us informed.
And Marie-Louise, I think that is the point about not giving false hope or false dates as well, because that raises a level of expectation that can cause more pressure and cause more upset. And that's why the Executive has taken this approach. The dates that are in the plan are the dates that we will take those reviews as an Executive. So 4 dates are already laid out there for people to look to as to what announcements will be made at that point. David Young, PA.
Afternoon, everyone. Minister, last week you referred to your concerns about politicking and the potential impact that might have had in relation to the Executive's COVID response last year. We're not 24 hours beyond the publication of the exit strategy, and there are already signs that there are political tensions in regard to with.
Sorry, David has froze there.
Politicking may hinder the implementation of this plan as it is rolled out in the weeks and months ahead.
Sorry, you froze there mid-sentence, David, but I think I get the gist of your question. Look, in regards to where we are in our next steps here in Northern Ireland, what we've seen and what we've seen over the past 12 months is that when the Executive stands together and proposes that same single message that we can get through this, that we have to take those cautious steps that have been laid out in the plan, that have been supported by all 5 parties. That's when the people of Northern Ireland support us and what we need to do. That's when the people of Northern Ireland support our health service and how it reacts to the pressures that COVID-19 actually brings to it. So what I think we've seen is a document produced that gives us that direction, that has been supported unanimously and was signed off by all 5 parties around the Executive table. And I would ask them for a consistency in message that we support the plan that is laid out in this document. I don't think it's perfect, but when you look at what other governments in other areas have produced as well, no one's been able to produce a perfect plan to deal with this virus, because this virus does not follow plans, it does not follow calendars. So this is about the direction of travel that we as an executive will take, and we need to take here in Northern Ireland as a collective, because we know when we stand together, we can defeat this virus and we get a better result.
And you referred to other jurisdictions there. Boris Johnson has, with his plans, essentially painted a picture that come the middle of June or the late June, that England, if everything goes well, could be free of restrictions, major restrictions. What is your hope for what Northern Ireland may look like come the middle of June, notwithstanding there are no dates at this point, but what is your hope that Northern Ireland may look like at that point? And maybe if the Chief Medical Officer wants to give his view on that as well.
Well, David, I think one of the things, and I said in the previous answer there, we have set in the plan has set those 4 review dates. They don't mean to say that we move to each step at those points. What the Prime Minister has set out in his plan for England is the earliest opportunity or the earliest date that they may move. So again, it's about, I suppose, a target date that they've set, not something that's set in stone. Again, there is always a concern. It's a concern that we have shared about the opportunity and the concern that comes by setting false hope as well. It's not something that I want to do. It's not something that I think actually helps. I think you've heard from our interim mental health champion in regards to the dangers about setting those false dates can actually cause as well. When we get to June, I hope, well, I suspect we will be in a far better place, because we've seen the reactions of the people of Northern Ireland and been able to manage the spread of this virus. When they do follow the guidance that we set out, the regulations that we set out, but also the benefit that our vaccine programme brings as well. So when you look at those review dates, I think the last review date that's actually in the document itself is towards the start of June. So as an executive, we were looking at that as a point at where we can take, I suppose, a more clear direction as to where we will be over the summer. Michael?
Yes, thanks, David, for the question. I think I'm on record as saying I look forward to this summer being more like last. Some of the freedoms that we all had last summer that I think have been detrimental and us not having over the course of the last number of months. And I think those are the difficult issues that at all times we're trying to balance. As Siobhan and the Minister have said, the benefits of some of the measures we have in place and checking the spread of the virus, protecting people, protecting our health service. So at each stage, the Executive is looking as to whether those measures are proportionate, whether they're necessary. And we will not, I am absolutely confident, be advising, nor indeed will ministers have any measure in place for a minute longer than is absolutely necessary, because it has always been weighing up how we control the virus, minimise the impacts of the virus, versus the undoubted harms that some of the steps that we've had to take to protect us all from the virus. And as I said in my comments, and the Minister alluded to in his, increasingly the vaccination will do a lot of the heavy lifting. It will not do it alone, and hence we will need other tools to be deployed, such as the further rollout of the new testing initiatives that the Minister alluded to in his statement, and that will include in the public sector and the private sector and certain sectors where we know that there is greater risk. It will also mean the continuation of our contact tracing service and the excellent performance of that. So these are all, and again, some of the measures that we are all taking and continue to take to limit the spread of the virus. So hopefully with all of that combination of interventions, we can look forward to a summer which is a little more like last, and we have some of the freedoms that none of us have had for quite some considerable time.
Okay, thanks, David. Tara McLaughlin, Downtown Cool.
Yes, good afternoon. My first question is for Professor O'Neill, and I know that the Health Minister has said today, after a suicide prevention group meeting, that suicide rates haven't shown an increase during the pandemic, but we know that there's always a delay in reporting suicide rates because there has to be an inquest. Is that something that you're concerned about, or is that something that you foresee?
The suicide rates, yes, there's a delay, but it's important to note that the suspected suicides are monitored regularly. So on almost a daily, weekly basis, we would have information coming through around what the numbers of suspected suicides. And again, that surveillance work is demonstrating that there has been no increase. In fact, there's been a bit of a decrease, but rates do fluctuate from one month and 1 year to the next. But certainly there has been no increase, and we don't foresee that in the near future. What we do know, though, that the economic downturns can be associated with changes in suicide rates as well, and we need to just keep an eye on this and carefully monitor it going forward. There's also some research data coming through that's telling us that people feel that more people feel suicidal, that many people feel that life is not worth living and people are losing hope, and that's very, very worrying to hear that. So again, we must look after our mental health and well-being and reach out to people who might be struggling right now, and always monitor this issue and take necessary steps if we feel that there would be any sort of increase. But it's not happening right now, and that's the same in all of the UK regions.
Thank you. And for the Health Minister then, you mentioned in your opening remarks about the mass vaccination site at the SSE. I'm just wondering if you can give us a bit of an update on that. Given the success of the rollout so far, could we see vaccines being offered to the general population any sooner than originally planned at all?
I think, Tara, one of the things we've seen through our vaccination programme is that we've been able to bring forward all of our cohorts by a number of days, in some cases a number of weeks, in regards to where we thought we've been. It's always, I suppose, it's always curtailed by the supply of vaccine rather than our ability to deliver. So the idea of our centre at the SSE is about that mass vaccination opportunity for the general public, and we'll start there. I hope by the 29th of March, our indicators would be we could be delivering up to 40,000 vaccinations per week at that site, but again, dependent on supply. If we can do that in conjunction with our other regional centres, with our GPs, and supported later in the time with community pharmacy as well, it allows us to accelerate not just the delivery, but also make it easier for a local access point of view as we start moving down through the age cohorts. So, it's something that has taken a large amount of planning from Patricia Donnelly and her team, but it's something that we're already seeing is starting to pay dividends here in Northern Ireland. Okay, folks, thank you.